Welcome to the Neuromodulation Podcast, presented to you by the International Neuromodulation Society. Dive into the forefront of today's emerging neuromodulation techniques, insights, and ethical and clinical applications. Subscribe now to join the multidisciplinary collaboration of medical care providers, scientists, and engineers who are part of the global conversation that's shaping the future of healthcare. Welcome to today's episode of the Neuromodulation Podcast, presented by the International Neuromodulation Society. I'm pleased to be today's host. My name is Mandy Soleil, and I'm here with Drs. Sean Lee and Alexios Karanopoulos. Sean Lee specializes in interventional pain management. His clinical interest is in neuromodulation therapies such as spinal cord stimulation, high-frequency stimulation, dorsal root ganglion stimulation, and peripheral nerve stimulation. He's a regional director at the National Spine and Pain Centers and an adjunct associate professor in the Department of Anesthesiology at Rutgers, New Jersey Medical School in Newark, New Jersey. Dr. Lee serves on the Education Committee and Young Neuromodulators Committee at the International Neuromodulation Society, on the Mentoring Committee for the North American Neuromodulation Society, is past president of the New Jersey Society of Interventional Pain Physicians, and is the treasurer of the American Society of Pain and Neuroscience. Dr. Lee earned his medical degree from State University of New York at Stony Brook and underwent residency training in general surgery at the Mayo Clinic in Rochester, Minnesota. He later pursued anesthesiology at the University of Michigan in Ann Arbor, Michigan. He completed his fellowship in interventional pain medicine at Johns Hopkins University in Baltimore, Maryland. And Dr. Alexios Karanopoulos, we've had on the show in the past on a topic regarding neurorehabilitation. You can check out his full bio there. So I'll give a streamlined one here today for you. Dr. Karanopoulos is board certified in both physical medicine and rehabilitation, as well as in pain medicine. He completed his residency in physical medicine and rehabilitation at Harvard Medical School and his fellowship in pain medicine at Dartmouth Medical School. He earned a master's degree in public health from Johns Hopkins University and a certification in medical acupuncture from Harvard University. He spent 13 years as a U.S. Navy diver and submarine officer and is a specialist in undersea medicine and radiation health. Welcome to both of you.
Thank you. Thank you.
So on today's show, we're going to be talking about early career neuromodulators. We've got two folks here who have been instrumental in leading the Young Neuromodulators Committee at the INS and in developing an international mentorship program for neuromodulators. Sean, we'll start with you. Could you give us a little bit of insight into why you've become a leader as part of the Young Neuromodulators space?
I think being a leader means many things, not just being successful at practicing medicine. I think being a leader also includes how to bring others with you in your success. And I couldn't have never been where I am today without having great teachers and mentors along the way. So the best way to help others to have success of their own is to help them find those mentors in their life that will change their careers.
And where you've come today is a rather prominent physician who's had a lot of impact in the field of neuromodulation. Why are you here in this field? What drew you to neuromodulation?
I think neuromodulation comprises a combination of science, medicine, and the ability to help people at their worst. To be able to treat chronic pain is a privilege, and to utilize cutting-edge technology such as neuromodulation, it really allows me to express certain passions that go along with my interest in technologies, along with my interest in treating patients, and just seeing how they respond, and rather quickly.
And Dr. Karanopoulos, how about yourself? Why lead in the young neuromodulators space, and how did you land in neuromodulation?
Similar to Dr. Lee, I think it's all about giving back. I recall Sean and I were training and coming out of training at about the same time. And when I reflect back, it only took one or two people to sort of put me under their wing to guide me. And I think that's helped us both to get where we are. And I think it's really important to not only help those who are behind us, because inevitably it'll help all of us, but it's a good way to continue educating yourself, whether that be about the technology or about interpersonal skills and relationships, or just staying current in daily events that would affect the practice of medicine.
Neither of you are particularly young neuromodulators at this point, but you've been really instrumental in creating space for budding neuromodulators in the field since you were. From your early days, what were some experiences that you had that had a particularly meaningful impact on getting you to where you're at now in your career? We'll start with you, Alexios.
I think when I was early on, I would say yes to a lot of things. I just wanted to get engaged and get to know people. And I think that was critical because it gave others the opportunity to get to know me. It gave me the opportunity to get to know them and to work hard and to set myself on a path that would help me to get to where I am. And I have several people that have helped me along the way. And whether it was through writing papers, and sometimes it wasn't so glamorous, sometimes it was just looking over a bunch of papers and coming up with a data schema that would help us to look at data in aggregate. Sometimes it was looking up resources, but it was an opportunity for me to get engaged, to work with some of the big names in neuromodulation, and to develop personal and professional relationships that otherwise I wouldn't have had.
What about yourself, Dr. Lee? Was there anything in the early days that you feel was really instrumental in getting you to where you are now?
Yeah, I think going out in the wild after training, it's a daunting and terrifying thought. Having all these opportunities, there's a lot of technologies. Our field has procedures that can be financially lucrative, and sometimes pitfalls arise if you fall on the wrong path. I think having the right folks that point you in the right direction and mentors to avoid those pitfalls and avoid those wrong paths, and memorable remarks by these people are simply saying, I've made more mistakes than you have, and I want to do the same thing. I want to help other folks maybe avoid some of the mistakes I've made along the way. And it's a rapidly changing field, so things happen very quickly. And as what Alexio said, there's a lot of opportunities, but at the same time, we have to be very selective and make sure that we don't get lured into the wrong ways.
You mentioned it can be scary going into the wild, as you said. Can you tell me more about what that was like, being an early neuromodulator and dipping your toes in this field for the first time, maybe doing your first implantation?
So in fellowship, you've always had somebody behind you. You had your attending standing behind you, and there's moments of uncertainty. You could look back. Even growing up as a child, you had your parents standing behind you in moments of uncertainty. But being in private practice or in academic practice where you are, being the last person that can either really make a difference for the good or can potentially injure somebody is a terrifying thought. So having others that you can lean on and get advice from is a comforting thought. It requires a little bit of a learning curve that's self-learning, but hopefully with a little bit of a safety net.
Dr. Karanopoulos, how did those early days feel for you? And do you have any insights that you might pass along to young neuromodulators who are trying to overcome some of those same barriers?
I think a lot of it is building self-confidence and reflecting back on the training that you received, using your network, whether it's me calling Sean or somebody else that helped to mentor me, and staying focused. Being the person in the room who's responsible for the case is a big responsibility. And at least when I was transitioning out of training, the idea of a non-surgeon putting an implant in a patient was sort of anathema to the nurses or the support staff in an academic hospital. Who is this non-neurosurgeon, non-orthopedic surgeon cutting the skin and putting this device in? So a lot of that was just educating and overcoming perceptions about what my training is and what my capabilities were. So I think it's really important to remember your training, fall back on your training, and never be afraid to ask questions, to use your network, and to say, I don't know.
For listeners who might not understand the implications of your academic background, could you give context into what training qualifies you to implant devices?
That's a great question. And I think that's somewhat variable depending on the academic community or private practice setting you're in. But from our perspective, as we are involved in multiple national and international societies, you have to do an ACGME accredited residency in the United States as of now. Other training programs that are foreign graduates, et cetera. There's certainly training equivalents or requirements, but in the US, an ACGME accredited residency program and fellowship program, from my perspective, are ideal. There are some non-ACGME accredited spine fellowships that fall into a different sort of rubric, but whether you're anesthesia, whether you're physical medicine rehab, whether you're neurology, radiology, et cetera, the field of pain management is growing. And it shows the breadth of what we do and the importance of looking at the broader pain spectrum and looking at pain treatment from a comprehensive paradigm.
So I'd like to shift now to talk a little bit about your work on the Young Neuromodulators Committee. Both of you have been in leadership on this committee as part of the INS for the last 5 or so years. Can you share a little bit about what that committee's core mission is and how you work to achieve those goals?
So I think having benefited from being a member of INS and grown up in the society and had great mentorship, we wanted to answer our call to give back and to develop a program where we can take on those needs where we have physicians coming out of training. We wanted to provide a source of added training, mentorship, and an avenue for people to find those resources in a society, in a professional society. So this is where we went to work.
And the mentorship program that the INS offers, you two have both been really instrumental in helping to develop. Alexios, could you share a little bit about the INS's mentorship program, why you feel it's important, and how supporting young neuromodulators is meaningful to the field?
Sure. To piggyback on what Sean said, I think one of the goals that we had at the outset was to really formalize or provide a better structure for mentoring. And it's important to remember that not all students learn the same way. Not all teachers teach the same way. So I think we were trying to come up with something nationally and internationally that made sense by pairing people that had similar training, similar communication skills, similar objectives. We set out to make a structure that would facilitate that, whether that's through advising on when to meet or how to meet, or what goals could be set, whether it's academic goals or networking goals, or building skill set, clinical goals and procedural goals. And by creating a buzz and by creating this program, we're able to gather enough attention that there were opportunities to match people that would make sense, that would benefit both the mentor and the mentee.
Makes sense. Have there been any notable learning lessons from the early years of doing that that have informed how to improve the program?
There are always lessons to be learned. And I think we've built the program to a point where it's in a much better place, whether it be through differences in language or communication style or geography, time zones, or really making sure that expectations are understood from the outset and are compatible with a professional relationship with a mentor-mentee. I think those are all things that we've come a long way with.
I would agree with all those. And having the I in INS is such a diverse group of people. And we celebrate that. We know that there's differences in how pain medicine is delivered throughout the world. And we use that as an opportunity to learn from each other. I think mentorship can be set up at any kind of different form or place, but there may be those that are aggressive enough or motivated enough to do that on their own. But we wanted to formalize and have a structure so that those that may feel a little bit reserved or timid about doing that has an avenue or has resources to come forward and express interest in such a program and to get paired up with mentors so that they can participate in such a program. So having structure, and I would say those challenges, they're real. Time zones, just the international aspect is a true phenomenon, trying to find time where everybody's available, and even language barriers. But I think those are easy things to overcome with the technologies and Zoom, certainly. But having that huge diversity is what makes this program so special.
And applicants can pursue the formal INS mentorship program in the fall. For mentees who might be interested in finding a mentor outside of a formalized program, do you have any recommendations for how you would say young neuromodulators could best go about that?
We're happy to be a resource, and through the INS and through our networks, I'm sure we can help to guide those different potential opportunities. I think one of the things that we've most learned in the last 5 or 6 years is to be flexible and adaptable, because not all situations are the same, not all teaching styles are the same, not all expectations are the same. And as educators, we want to make sure that we give opportunities that work for the individual.
I would even emphasize that this is a two-way relationship, not just us recruiting mentees, but I think mentors get quite a bit out of it as well. So we would definitely like those that are established in their career to express their interest in becoming a mentor, because they can get as much out of that experience as anyone else and help them continue to grow and develop and continue their knowledge in neuromodulation. I want them to voice their interests so that we can serve as facilitators to match these folks.
Do either of you have examples from your own experience with either being a mentor or a mentee that have been really instrumental in shaping your career or your development as a physician?
Early on, I was able to connect with some of the pioneers in pain medicine, and I got my name on publications that I otherwise wouldn't have. I got access to data and to the technical expertise and the academic experience that's required of writing papers, of giving talks, of being involved in committee work that I wouldn't have had. In terms of specific experiences, there are many. There have been multiple people who have influenced me, and I've tried to do the same. But in short, it's helped me to be a broader, more learned physician that looks at things from a different perspective.
Thanks, Dr. Karanopoulos. What about yourself, Dr. Lee?
Yeah, I think the whole mentor and mentee relationship in medicine is still very much apprenticeship than anything else. It's not a set of skills that you can get through a textbook if that were that easy. So I think that the learning of medicine never ends, and there's always someone that can teach us something. And again, going back to having benefited from having a good mentor, I can remember just coming to meetings where having somebody introduce you to the people that you need to know from a networking perspective. And I catch myself doing the same because um, I feel like that's the best way to give back. And more recently, I got to see one of my mentees present on a podium. And oddly enough, I got more excited than probably the person giving the talk. So there are some really unspoken or these gratifying moments are hard to quantify, but I think it really adds to the depth of what medicine gives us.
I want to shift a little bit to talk about diversity in neuromodulation because age is one piece of that puzzle. Whether you are new to your career as a neuromodulator or younger because you're early in your career in medicine, I'm curious how important you think age is in shaping the future of neuromodulation in terms of having a diversity of perspectives. Where do you think that comes in the most prominently?
I'm going to take a stab at that one. I think maturity gives one wisdom and different views on life. I wish I had traveled more and seen different things younger so that I can help patients better. But just like any aspect of medicine, age brings us a level of maturity that allows us to understand, to provide the level of empathy that we really need. Chronic pain patients deserve that extra amount of sensitivity and understanding. I think chronologic age, I think obviously younger folks are coming out of training, but I don't care how old you are. If you're new to neuromodulation, your life experiences can also bring to the table where you can teach possibly your mentor a few things. So I think going back to what I said about a two-way relationship, the pairs should be better individually after that whole experience than they were when they started it. So it's not a one-person experience. It should be a two-way experience.
Dr. Karanopoulos, we were speaking recently about your experience as a professor and working with different generations from your own. You have any comments about that you might be interested in sharing with the listeners?
Sure. It's been a learning experience for myself, and I teach at an Ivy League school and with really intelligent and motivated and curious students. But certainly the learning style of this generation is very different than the learning style that I was exposed to, and more looking at the traditional medicine and the Socratic method. I think now it's much more dialogue driven, much more case driven, much more focused on real interactions. And that makes for a challenge sometimes in understanding communication styles and understanding learning styles. And certainly we're much more aware of differences in the way people learn. Some people can go to a class and learn what they need to learn. Some people don't go to class at all and then get much more out of it by studying remotely. So I think it's really important that we've adapted in our understanding of whether there are disabilities or impairments or situations that need to be considered in being broad in your education style.
What about your work with younger generations and your mentality and how you approach that? Do you think can provide insight to mentors who are trying to figure out how to communicate across generational divides? Do you have any advice that you might give?
I think it's really important to listen, and that applies when you're an educator, but also as a clinician. You have to listen to the patient, but you also have to listen to your students and try to understand where they're coming from, where they want to go, and how they want to get there. Whether it's sitting down one-to-one with students and getting to know them, getting to know their specific needs, or having a group session or a combination, I think it needs to be customized within reason to get the most out of the education process.
That was a great answer. I think part of it, we have to embrace that generational gap. And so understanding that learning process may be different now. But I think my advice to mentors going in, now that I've done that a few times, is to keep a really open mind and not to have certain expectations and to be able to adapt because, as Alexio says, the learning process may be different. How we used to learn is different than how another generation may do it, but it may not be any worse and they may even do it better and we may learn from them. So I think those are things that will help that relationship develop, is just not have preset expectations.
So, in terms of the relationships that you have with your current mentees, do you have any stories around the impact of the work that you've done with mentees and the relationship that you've built?
Having done this several years now, I've maintained contact and close contact with all of my mentees. And whether it's purely professional or personal and professional, I continue to learn. And I've had great experiences, whether that be continuing to write papers, whether that's doing research, whether that's talking on the phone when one of us has a question. I think it's built my network in a very healthy way and in a very rewarding way.
I would very much agree with that. And just learning all the different aspects of what the mentees bring. It may not be in neuromodulation, but through those interactions and conversations, I'm just impressed how quick folks now coming out of training are, the access to technology. Dating myself, when I used to look for a reference or a paper, if you had the access to the computer, that's great. But sometimes you actually have to go and find that paper somewhere and maybe have them email it or fax it to you through certain sources. But these younger folks, they pull it up on their phone before you finish the sentence. So access to technology and information is rapidly changing. And if one thing I can say that it's helped me is to stay young, is to realize how quick information is changing, how quick the technology is advancing, and to force myself to stay relevant. And that's a pitch to potential mentors out there, is the ability to be in a program where you're encouraged to stay relevant and to be in the current.
Not to rely on the fax machine.
Well, one of the ways that the field as a whole stays relevant is through research. I'm curious, have either of you had the opportunity to partner with a mentee or a mentor on a research project?
Absolutely. Whether that be research is a sort of a catch-all, but research could include writing an abstract. It could include getting involved in true randomized controlled trials. It could be in participating in an academic or scholar activity like journal clubs, think tank sessions. And I think it's important to look at the scholarly activity as broad. And not everybody can sit at a desk and write a paper. Some people are better at communicating and thinking about advising, being on a scientific advisory committee where they can think out of the box. So again, it's adapting your own learning style to make it more palatable for others and to advance what we're doing in medicine.
Yeah, research is a very broad term. It can mean a lot of things to different people. And some of those expectations of potential mentees coming in is everybody can say, I want to do research, but the end result requires quite a bit of work. I think helping folks to understand that you have to put in the work. And I've experienced having worked together with mentees on projects that they can finish, that gets to a situation where they can publish or get on a podium is quite rewarding. But seeing them put in the hard work is a nice way to show someone that that word is not, it's easy to see on papers, it's easy to see podiums, but it comes with a lot of hard work on the back end that's not always glamorous. So that experience can be teased out during such programs in the relationship between a mentor and mentee. And it doesn't have to be public. Those experiences will allow both to be much stronger and allow them to do what they want to do in their careers.
If I may, so if we reflect back on true research as in the setting of academia, and if that's the passion of your mentee, then it's really important to teach the scientific method and to talk about academic and scientific rigor. And for the science to be important, it needs to be legitimate and it needs to be reproducible and understandable. So again, whether you're writing papers, whether you're collating data, or whether you're actually doing work in a trial that would compare a drug or device, it's really important to know how you're doing it and to do it the appropriate way.
With respect to advancing the field of neuromodulation, young neuromodulators will undoubtedly have an impact as they'll be the future of the field. I'm curious if you can get us a bit excited about what's to come. What are the technological advancements that you think are going to really shape the future of this field for young neuromodulators?
From the time that Sean and I were fellows, you just think back, the names of the companies were very different. The devices were very different. The generalizability of the technology in neuromodulation was very different. We've come a long way in a short amount of time. So now with the advent of artificial intelligence, whether that be through augmented reality or virtual reality or the data that's going to predict us where to go, I think the future is really exciting for our field. But we need to continue to be good stewards of the technology and the science to make sure that we're doing the right thing for the right patient.
Couldn't agree more. I think the responsibility factor, the pace and the cadence of how things are brought to the clinical sense is much quicker now. The studies that once took years to complete, now you have the assistance of computational modeling and maybe one day even AI, rapid pace. But that comes with the lure of all these toys. And the end result is these toys, I'm using that in a facetious way, but these toys ultimately will have an effect on a human being, good and bad. So we have to be really responsible how we implement those and not really let other influences cloud our judgment and really put our patients' well-being first and foremost.
What about young neuromodulators who are interested in advancing their career? What advice would you give them, and how can they perhaps get involved with a committee like the Young Neuromodulators Group?
Yeah, I think career development is as much a part of the spirit of INS, the spirit of our committees, and the mentorship program. We want to help these folks to develop in their careers, but I think it's got to be done in the right way, meaning that your goal is to learn through the process of maybe perhaps giving up your time to serve on a committee and learning through that process and developing a network, maybe perhaps being part of a mentorship program, and then through that process, learn how to develop your career. I think coming in thinking that I'm going to get something out of it because I do this, I think it'd be the wrong approach to do it.
So, trying to come forward with a what can I offer approach just as much as you look to gain knowledge.
Right.
I think it comes back to some of the basics in developing relationships. You want to be communicative. You want to be reliable. You want to be present. You want to have follow-up. So simple things that are important in everyday relationship building, but also in everyday practice of medicine.
Any final bits of advice for our listeners today?
Thank you to the INS for giving us this opportunity. I think we both learned tremendously from the committee work that we've been involved in and also our mentor-mentee relationships. But the committee itself, Young Neuromodulators, has a great future, and we need people to come in and help us to continue to build it and to evolve it. I hope we've generated some interest, and please come and help.
I would say it's been a learning experience for me, definitely, and been a growth experience to be able to have great relationships and mentorships and build friendships. So I think overall, this is something that anyone's interested in through the society. INS has been so supportive of our efforts, and we want to continue to give back to the younger generation of neuromodulators.
With that, I want to thank Dr. Karanopoulos and Dr. Lee here for joining us for today's episode of the Neuromodulation Podcast. Be sure to subscribe so that you get notified when the next episode releases. And we will have another episode coming up that features a mentor and their mentee discussing what the relationship building process was like and providing insights on how you can best develop those relationships. So with that, thank you for being here today.